Hi everyone, and welcome to today's webinar, A Safe Return to Youth Sports, What Professionals Should Know, brought to you by Sports Health at NYU Langone. Before we begin, please take a moment to mute your computer microphone or telephone. If you would like to submit a question to our speakers, please type it in the Q&A box on the bottom right corner of your screen, and we will try to answer as many questions later in the presentation. We will also record today's webinar, which will be published on our YouTube channel at youtube.com/NYULMC. I'm now pleased to introduce our esteemed panel of speakers, Drs. Dennis Cardone and Cordelia Carter, orthopedic surgery and sports medicine specialists and co-directors of the Center for Young Athletes at NYU Langone. Dr. Rebecca Pallet-Madden, a pediatric infectious disease specialist at Hassenfeld Children's Hospital, part of NYU Langone. Julia Drittel, a program coordinator and athletic trainer at NYU Langone's Concussion Center. And Brendan Parent, director of the NYU Sports and Society program and assistant professor of Division of Medical Ethics at NYU Grossman School of Medicine. Welcome, and thank you all for leading today's discussion.
To have this many participants. Oh, I am unmuted now. Yes, good. So excited to have this many participants, and I'm so excited to be joined, honestly, by true experts to help us think about this. Julia, can you go to the next slide, please? This should be self-explanatory, but if you do have a question we'll be monitoring, just type it into the Q&A box on the bottom right of your screen. Next slide, please. Oh, well, there we were. Go back. This is even though maybe we look a little different in the current times. This is our fabulous panel. And then just before we get started, I'd like to preface this webinar by making a couple of points. The first is that the concept of this session is that of a focused discussion involving a multidisciplinary group of panelists with expertise in pediatric sports medicine, infectious disease, and bioethics. So our goal is to provide a framework for participants for use in making decisions for ourselves, for our families, communities, and our patients as we think about returning young athletes to sports. Members of this panel have provided clinical care to patients infected with and affected by COVID-19, and many of us also work with local schools as well as larger national sports organizations and that are tackling these very questions that we'll tackle tonight. And we will draw from our experiences throughout this discussion. And then lastly, as you all know, one of the particular challenges regarding COVID-19 is the rapidly growing and sometimes contradictory scientific data. And this is what we use. It's what underpins our clinical and public health decision-making. And so today we will discuss the most up-to-date evidence while acknowledging that our thinking may evolve as our collective experience with COVID-19 grows. And with that, this really is supposed to be an interactive, almost like case-based discussion. So Julia, would you go to our first question, please? All right, here's our first discussion point. In the event that we get the green light that our season will happen, what are some of the first steps that an organization should take? And I'd like Julia to chime in first with this, and then Rebecca next.
Great. I want to say that the first steps should actually happen before you get the green light. Can everyone hear me? Yeah, okay. So before you even get the go-ahead to start, that's the time to start putting your plan down on paper. You want to consider things like the infection rates, and if it goes back up, what's your cutoff for bringing the sport participation kind of back a step? What's your age, the age cohort that you're working with? Are children, young children, going to be less compliant with maintaining 6 feet the way that high school students may understand the consequences a little bit better? What risk level does the sport itself have, and how can you mitigate those risks indoor and outdoor? Can you move an indoor sport outside? Like I've seen a wrestling tournament happen outside, and that was pre-COVID. And then, you know, figuring out how you're going to afford the PPE that you're going to need, the protective equipment, the hand sanitizer, disinfectant, working out your budget again before you really get started. And one that people don't really think about is bathroom availability. What is that going to look like? So you think about the field or the court, but what's the like the logistics of the facility itself?
I think, as sports medicine providers, we all have an emergency action plan that's based on, where the facility is, the sport, and all the stuff that you just mentioned. And I think that, just as you said, a lot of this is preparation, and it's about a risk assessment for your specific situation. In terms of COVID specifically, Dr. Pellet-Madden, do you have anything to add to that?
I think having a good established chain of communication with families is really important. So working ahead of the season to determine how you're going to communicate with families, what sort of information is going to be communicated, and in particular, who will be your contact in the community, whether it's someone based in a hospital or someone at the Department of Health, who you're going to contact should you have a problem that arises. You may also want to consider what kind of screening practices are going to be in place before events. Are you going to be doing a daily symptom check with families? How are you going to implement that? But again, really the first step is understanding your local epidemiology and ensuring that you're working with your local Department of Health and your local schools to ensure that the epidemiology is favorable, that it's okay to proceed to the best of our understanding.
Do you have specific, and maybe the answer is no, but what is favorable epidemiology? What does that mean?
So what we've been watching, and you'll see this in the newspaper, is kind of each state and each county publishes data in terms of how many new cases they have in the past 2 weeks, whether the cases are going up or down, whether they've plateaued, and how many new cases are they finding for every one person infected. So in New York City, we have felt somewhat more comfortable having our children be more physically active with one another because the number of cases overall has plateaued. We've had around 1% positive for, if you consider our total denominator of tests that are being done on a daily basis. And the number of new people getting infected for every index case is really quite low right now.
Perfect. Let's move, just in the interest of time, let's move to the second question. Julia, can you advance it? And I think we touched on this a little bit already, but so is it possible to have contact and play if the kids wear masks? What can we do to ensure their health and safety? And will this vary depending on sport? Let's see. Actually, well, let's go back to Julia and or Dennis if you want to chime in with that one too.
Yeah, I could definitely start with this one and put some in. One, I think it's very difficult. I think, as we'd all agree, to ask children, adolescents, and even our high school and collegiate athletes to use masks when they're playing sports. I think that's very difficult. And even if they do start to wear masks at the beginning, it's likely that the mask won't be staying on and it won't be effective. And we also, the thing that we don't talk about, is there even risk to wearing a mask, especially on a contact sport, if that mask gets pulled on or tugged on by an opposing player. So I think there's certainly some concern about masks. I mean, I know we all need to ensure that, coaching fans, parents are certainly wearing masks. That's absolute. But I think it's very difficult for us to, with the expectation to have our, athletes wearing masks when they're on the field, especially for if we talk about contact sports.
So, I mean, I think this is just a really tough one because, and I'd like to have Dr. Pellet-Madden chime in with this one too, because I think this is one of those, you can have guidance, but as soon as you get it into the real world and try to put it into practice, it is nearly impossible, or maybe there are even the unexpected, right, what you can, could you have a near strangulation or get choked or whatever it might be. So could there actually be an unanticipated problem? But I suspect that we all know there's value in wearing masks as well. So Dr. Pellet-Madden, what do you think? Hold on one second. Yeah.
I think for very young children, like pre-K, elementary school, I think the masks are pretty low yield. And I think then as children get older, even if the risk of transmission goes up, really, again, it's to a certain degree all or nothing. If the risk of transmission is really so significant based on epidemiology, then the kids probably shouldn't be really coming into close contact. So I don't know that masks are going to be super feasible or super effective for the kids themselves who are playing. But where I do think the masks have a role is for the adults who are there, the coaches who are there, the small number of parents who may be there. I think that those are really the people who need to be wearing masks diligently, not pulling them down to talk to people. I mean, I'm capable of standing in a patient's room for an hour and talking with a mask, so I know we can do it on the field. And in particular, the parents who are there as bystanders need to be masked and keeping their distance as much as possible.
Can you also comment on, actually, we've touched on this a little bit, but I think that our understanding of how a child's age may mitigate risks is evolving kind of quickly. Tell me, or explain even to our participants, if you would, like the current thinking on younger versus older kids, or prepubescence versus the adolescent.
So keep in mind, we don't know a whole lot about this because COVID has only been known to us since the winter. And for much of that time, children across the world were kept isolated from their peers. So to be honest, we don't have a ton of great data in terms of how children do or do not facilitate transmission. The data that we have so far suggests that unlike influenza, babies, toddlers, young children do not seem to be the major vectors here, that they tend to acquire COVID from their older household contacts. And a lot of what we know or suspect so far about COVID in adults is that infection, replication, spreading of the virus is very dependent on ACE inhibitors that are in the body, but especially in the respiratory tract. There's some very limited data that older children, who knows, maybe because they're approaching or have gone through puberty and have more ACE inhibitors, may transmit the virus in a way that is a bit more similar to older adults. But again, those data are very limited and they are incomplete.
So Dr. Pellin-Matt, and I don't know if you had an opportunity, there was an article in the New York Times over the weekend of a study that came out of South Korea.
Right.
And they did, and it was very suggestive that beginning at age 10, in that group they were looking at 10 to 19, that transmission as a vector was similar to an adult.
Right.
Can you comment?
Right.
Can you comment on that?
And I don't think we don't understand the physiology. I mean, again, it's one study, although it's an important study. And again, it may be that as children are approaching puberty, around the age of 9, 10, 11, that their physiology starts to become more like an adult. And for that reason, perhaps they're capable of shedding the virus and transmitting the virus in greater amounts.
And I think it's right. And then it becomes such an important point because now if those same children that are participating in sports that we're talking about, if they have somebody at home who's maybe in the older age group or some immunocompromised group, right now that's that strong consideration and family decisions about regarding return to sport or being on the field.
Right, right. You have to really keep in mind who is in the household, who is in the community, how interactive are you with the community? And I guess, that's why I'm really reluctant to say, well, it's okay if the kids wear masks, they can just go back to sports the way that it was before COVID, because masks may do a lot of benefit when a child is sitting at their desk in a confined space. I don't know how effective they're going to be in mitigating transmission when a child is really physically active, they're sweating, the mask is slipping down, they're coming into close contact. And so I think mask or no mask, we have to accept that when our children are playing with one another, when they're in close proximity, there is a risk of transmission. That risk of transmission will depend heavily upon local epidemiology. And we have to simply think about what's safe for our family and what's safe for our community. And it may be that until things are better, sports as we know it are going to be very different for the next year or so.
And I'd also like to chime in on that same kind of note. Probably while they're running and playing their sport, the masks, like you mentioned earlier, might be a hazard. But similar to the coaches and the parents wearing masks on the sideline, the kids could maybe wear that gator style where they just pull it up while they're on their bench, or they, maybe everyone gets a nail or an assigned seat on the bench and they put their mask there, go play, come back and put the mask back on.
Right.
Because that's when you're really sitting, next to your teammates, potentially huffing and puffing and recovering. And it's just, again, like a really simple thing you can do while you're not at risk and and needing to sprint up and down the field.
Right. And so many manufacturers now are making the plastic face shields that are available for adults and children. And those might be, they may not be exactly the same as a mask, but they may be a more effective alternative for kids who are really physically active, especially because they can be wiped down. They can be labeled with the kid's name. They can be put on a hook when they're not being used.
Yeah, there's some concern for me with that becoming some sort of like projectile or a sharp angle that, you just accidentally bump into someone else and end up hurting them with that plastic shield. But there's always pros and cons.
Yeah, they're pretty soft and flexible.
You'd be surprised how much kids can hurt each other.
I was going to make two comments just to chime in here. I think one is, I guess one bright light is that, or bright spot is that the kids who maybe are more likely to transmit it are also the ones who have the ability to understand and follow rules. And so really it's just going to be, it's really a matter of enforcing it. And that's actually, and so actually, frankly, I forget my second thought, but I think that let's actually talk about enforcing it, because we have a question that because this is the reality of what's going on. So the question is, I would love the panel's thoughts on this challenging mindset among parents and coaches that are prioritizing like the fear of the loss of the opportunity to be in sports and to, this doesn't say this, but, whether it's like going for, a college scholarship and like the lost time that we're having right now. It's sort of a loss of being able to put everything into perspective, but so they're really prioritizing the fear over the loss of competitive opportunities over probably personal as well as community health. And so this says, we have seen high school coaches sending kids to work out in public gyms because programs are shut. And so it seems like there's a lot of almost community cheating. What does, and yes, Brendan, please.
This is a problem, obviously. I think there are two important responses to this. One is that the coaches and the athletic directors' duties to their athletes is to provide the safest environment possible based on the existing data and in accordance with regulations. So if they are trying to find these workarounds that might not breach the letter of the law, but clearly subject their athletes to significant risk, that could be grounds for liability, even if a case is hard to prove that an athlete got infected because they were working out when they shouldn't have been. That's a problem. And so if it's a matter of motivating these coaches to try to maintain the right sort of environment, let them know that there could be a legal risk here too. And I'll say one other thing, which is that these kinds of moves that you're describing, i.e. sending the kids to work out in public gyms because programs are shut, the kids themselves might not do this, but they obviously fear the potential repercussions for not listening to their coaches. This is a form of coercion. And I think in a number of civil rights contexts and even Title IX requirements, that it's important not to create any kind of coercion or threaten the athletes with fear of potential loss of their starting position or scholarship or other opportunities in order to remain competitive.
Those are great points. I'll go through a couple more questions and then we'll go back to our slides. I'm going to do this one first. This says you are unrealistic with having kids put their masks on a bench and picking up their own mask. They can't even keep their own water bottles straight. I think this speaks to the, sure, we can make recommendations, but how do we actually implement them? And I think, and the panel was talking about this before we even started, I think it's about consistent implementation too, right? We may all start out with the best of intentions, but the more we the more we play and that nothing bad happens, the harder it is to reinforce those behaviors or to have them consistently happen. So, I mean, I think this is why especially youth sports is a challenge, but I also think that we're all sort of coming. I think there's a big push to just return to normal, and I think we'll have to come to an understanding that it's not going to be a return to normal. It's going to be setting a new norm. But does anybody else have something to comment with that?
Yeah, no, I think that's a really good point, exactly like you said. And I think certainly on the field, it's unrealistic to ask about masks, and we talked about that. But certainly in the bench, or when they're off the field, and like Julia was speaking to before, that does have to become the new norm. Spacing, coaches have to reinforce this all the time, so it becomes their normal standard that they're not congregating in one space closely, tightly, and that they are potentially reaching for their masks. I agree, if they're going in and out of sport, it's difficult to have in and out of their masks, but they don't have to congregate so closely as in the past. They need to be separated on the sideline. So we could definitely make some of these changes and, again, establish it as the new norm in sports.
Oh, please, Brendan.
Just one additional point, which is that, yes, new norm, but with the capacity to shift as new data comes in, right? So it's the new norm until we discover that epidemiology is out of control, and then maybe you have to shut things down again. So I just want to say this because I have sympathy for how difficult it is to be both consistent, but also flexible based on new information.
Well, then I think that we would all certainly say and feel very strongly is that we should be, and we are all strong proponents of sports and activities. So even, we talked about what should an organization do to even start up, and part of that is even just individual training, right? So it doesn't even have to be as a team. It could start, maybe there could be some instructions for athletes, even in youth sports, that they could be doing some pre-training, and this will be one good for them both mentally and physically, injury prevention programs, instead of coming right back on the field going from 0 to 60. So, I mean, these are important things, and they could always still maintain training.
Individually, I agree. We've had a couple people ask specifically about effectiveness of the gaiters. And so I'm not personally aware of great data in support or against them. But they do seem to be easier, just anecdotally, to use if you're exercising. So actually, Dr. Pellet-Madden, a thought on this, or anybody else on the panel?
I don't think we have great data on this. Yeah. We really don't. I think all of this kind of comes down to risk mitigation. We don't have a form of risk elimination. There will always be some risk for transmission that, again, is going to be guided mostly by local epidemiology, but there's kind of no foolproof way to eliminate risk. And I don't think we know right now necessarily which mask is better or safer. In general, I think a mask that's more comfortable, that a child touches less, is probably going to be the most effective mask there is. If they're constantly touching it, pulling it down, adjusting it, it's going to lose any efficacy that it offers.
I want to
Dr. Pellet-Madden, and I've seen some data. Some of the big sports wear companies, Under Armour, Adidas, Nike, whatever it might be, are coming out with masks, 2 and 3 layers thick. So the question is, does that make sense? And if you think, I think logistically they're saying, well, Under Armour just came out with a 3-layer mask, and they have some, like you said, not such great, obviously, scientific studies. But does that seem to make a difference? Do we know anything in terms of number of layers that they're using?
Not number of layers. I mean, a lot of this reflects just not so much the thickness of the mask, but in general how tight masks are over the nose and around the mouth. And by definition, a mask that fits really tightly around the nose and the mouth is not going to be really comfortable for exercise. I don't know quite as much about the number of layers, the various materials. I think it really has more to do with having a good seal and being comfortable so that the child isn't taking it off and adjusting it all the time.
Without committing anybody to this position, it's it's possible that an implication of what Dr. Pellet-Madden was saying earlier is that if you if you think you need a mask to play, then the sport is probably too dangerous to play, right? That's a possibility. I'm putting it out there. And the notion that, well, if we just wear masks, then maybe we can play. Or if we just wear the buff scarves with more layers, that's two-pronged problem, right? One is it might actually cause a choking risk, who knows, or it might make athletes take more risks than they would otherwise, just as we might see with a helmet. When people feel like they're protected, then they end up being a little bit more careless.
And that's what we've seen in sports all along with rule changes. Like there is always that concern of, if we add more protection, does it just give the athletes license to be more violent or take more risks or whatever it might be? Let's move on to let's just move on to the next slide, and then we can come back to questions. So Julia, would you advance it? What do we need to do if a child was previously sick with COVID-19 and is ready to return to sport? I would like to throw this back to Dr. Pellet-Madden to start. Sorry, we keep calling on you.
That's okay. Well, I mean, I would like Julia to comment particularly on tests that might need to be done in terms of pulmonary function and endurance and fatigue. What I can comment on is that a lot of parents might be worried about a phenomenon called multi-system inflammatory syndrome that is developed in a small number of children who seem to have had COVID. We don't yet know exactly how COVID causes this to happen. We don't understand how the immune system interacts with COVID, and we don't have any good way of knowing, the small number of children who get infected with COVID, which of the children who are going to go on to develop this syndrome. We don't know what makes one child get it and another child does not. We simply know that the children who actually get this multi-system inflammatory disorder, they seem to be the kind of the tip of the iceberg of all of the kids who get infected with COVID. The warning signs for parents are that if your child is having persistent fever, if they're having abdominal pain, if they're having a rash, their eyes are red, they're not able to eat and drink. Obviously, your child cannot be participating in sports with those symptoms, but those are the warning signs that you really need to call your doctor, do a telemedicine or in-person visit with your doctor, and maybe even come to the emergency room. But we so far don't have a way of identifying the children who are at risk for multi-system inflammatory disorder. And we don't know necessarily that returning to physical activity makes you more or less to develop that problem.
I think so. Julia, would you comment? And I think with this question, so first, how do we even decide a child is ready to return to sport? And I think that's where the multi-system inflammation comes in, right? As I know with some adults, we're learning that, organ systems are affected for a longer time or more chronically than we might have expected or than we understood early on. And so, do we have to actually change how we ensure that children are ready to return to sport? And then actually you could even tie into this, because one of the questions was, what about a pre-existing condition that might, like asthma, for example, how does that change your calculus?
So I, again, want to echo your first point of, say in the question, and is ready to return to sport. We don't know what that is yet. So after I make my comment, I would love to hear from Dr. Cardone or you, Dr. Carter, about what maybe we need to do as far as like an EKG or medical screening before we begin. But once we determine that, sure, they can go back on the field or the court, there's a consensus statement by some of the strength and conditioning associations. Granted, they're targeted at colleges, but could be translated for high school. And it's a consensus statement on returning people who have been sedentary for 2 weeks. So this is something, people probably have been sedentary for much longer, but the general guideline is that in the first week back, if you are going to do any conditioning testing, like there's the beep test where you're testing how much they can sprint in a certain amount of time, you need to do that on the very first day, and that really needs to start the baseline. And on that first day, you want to at least adjust it by 50%. So if you would expect them to sprint the length of a soccer field in 30 seconds, I forget how long it should take, you want to double that. And then the second any of the athletes show a sign of struggling, you stop. And then after the first week, you have the conditioning assessment, and then all of your training volume, whether it's in the weight room or on the field, should be 50% of what you would have otherwise expected from that athlete. And this is for a healthy person just returning from 2 weeks of sedentary activity. So I personally, there is no consensus statement on this, but I personally would probably rein it back even more, maybe 2 weeks of a 50% reduction. And then the second step is a 30% reduction, the third week a 20%, and a 10%. So we call it the 50, 30, 20, 10 guideline. And again, for COVID, it's such a unique situation, and it's far longer than 2 weeks. A lot of the even healthy children have been sedentary. You may want to consider dragging that out for more than just 1 week per phase.
I agree. I think the next question gets even more. But I agree with you. I think it's especially hard for young athletes to understand what it's like to be deconditioned because they've never experienced it. And so I think actually changing expectations and actually setting limits before we exceed ability is also going to be an important part of sort of determining how to return to play. But sorry, Dennis, please.
No, I was just going to, and from the other angle, I was going to talk a little bit about the pre-participation evaluation, because it's certainly a very important part of the return to sport and controversial. Access to care right now is a little bit more limited than it was. We're not doing these mass pre-participation evaluations. So many of the organizations are accepting pre-participations from evaluation clearance from at least 1 year ago. So key here is at least to do an interval history. And key here, too, is that there should be COVID-related questions on that history form. Has that athlete had COVID? So any athlete who has had or tested COVID positive, they should absolutely have an in-person visit with their physician healthcare provider. And then taking off on the other piece, if they had a complicated course in any way, then yes, there might be a reason to do specific pulmonary and cardiac testing. Certainly if they've had a past medical history of cardiac problems, maybe uncontrolled asthma, these are also athletes that we have big concern about, and they potentially will need other tests, but for sure, they need an in-person visit with their healthcare provider.
Right. We had a couple of sporadic cases of older children, really adolescents, who were endurance athletes who had, really, really mild febrile illness in March, April, but then had ongoing dyspnea, cough, and were found to have pulmonary emboli that we suspect were a complication of COVID. So, children right now who have chronic cough, exertion with exercise, you really have to take that seriously and have a comprehensive evaluation with your physician.
Let's go on to the next question. Julia, can you advance it? This is a little bit of a shift of gears. I'm an owner of a local hockey rink. Will I be liable if a child gets sick? And I think we can extend this to or a staff member or, even beyond. So Brendan, this one is for you.
So the short answer is it's absolutely possible. As the owner or proprietor of an establishment that hosts sports, youth sports, it's your duty to make the safest environment possible, understanding that there are some risks that anyone who plays a sport takes. But it's very important that as the person who makes this opportunity available, you are complying with all state, city, local policies and regulations, and that you make clear all of the efforts that you are taking to mitigate those risks to individuals who participate in your location. make sure that they know where the sanitizer stations are, what is expected of them while they participate. So this will help mitigate some risk. But for example, if, as Dr. Pellemadden says, the epidemiology is bad, your neighborhood is running rampant with COVID, and you're still operating your rink and inviting people in, then that definitely opens you up to more risk. So make sure to pay attention to the rules and regulations, make sure to pay attention to the data, and when in doubt, go more restrictive.
Brendan, can you speak to waivers? You know, certainly when it comes to sports, in the past, unrelated to COVID, you know, if someone had some kind of cardiac heart condition like hypertrophic cardiomyopathy, whatever it might be, you know, waivers really are meaningless. And in this COVID environment, I wondered if you could speak to that.
I'd be happy to. I know we have a slide dedicated to that, so I could either do it now or later. You tell me. I mean, now's a natural time if we're talking about it. So the answer about waivers, I'm not going to make recommendations one way or the other for coaches and teams to make athletes sign waivers or not, but I will say that there is no precedent for whether or not a liability waiver will hold up in court in the event that one of your athletes or one of your coaches gets sick and God forbid dies, and then you get sued. The waiver is a document which suggests that if it's upheld, that a suit cannot proceed, right? So whether waivers are even allowed is a state-by-state fact. Some states don't allow liability waivers, i.e. you sign this piece of paper, you participate in our game, you can't sue us. There are some states that don't even allow that. The states that do allow it tend to require that such a waiver would be in the public's interest. Well, what does that mean in this case, right? To allow sports organizers to offload the responsibility to athletes and their parents who are desperate to get back into play. I think it's a dangerous proposition. And I think that, you know, when thinking about Dr. Cardone's suggestion about an athlete who agrees to assume all the risks, including the possibility that they have HCM, hypertrophic cardiomyopathy, right, that they can't sue for these unforeseeable things. Well, COVID-19 is foreseeable, right? I think this is my personal assessment, and this is not legal advice, is that COVID-19 is now an inherent risk in all sports. And so everyone has to take some amount of responsibility for imposing those risks. So the best thing you can do, again, is be compliant with all of the regulations at the state, city, local, policy, institutional policy levels, and then continue to try to be as up to date as possible on the very local environmental information. Because as we know, government regulations, they don't keep up with the science, right? Something gets passed saying, okay, we're in phase 4, things are opening, people can play, and then there's a massive outbreak. It's going to take a while to update that at the government level. So it's your job to seek out the advice of experts, like the people on this panel, not me, but the others, to think about whether or not you can safely and responsibly continue playing.
Can you speak to risk tolerance, just like how that plays into this? Because I mean, I think, again, to me, the purpose of this discussion is about trying to provide a framework for just what questions to ask and how to even guide ourselves and our patients with decision making. But I do think that personal and community risk tolerance is so variable and yet so essential in this discussion.
Yeah, risk tolerance, I agree, is essential, and also a hard one, right? Because it's the tension between individual risk tolerance and public health responsibility. So some individuals and their family members might have a higher risk tolerance than others. I saw a question about a family sending their kid to practice who was COVID positive because they didn't want to lose their starting position. And I have so much sympathy for that. It's a horrible position to feel like you have to be in, but it is our duty, it is everyone's duty to look out for everyone else, right? So just because young people and athletes tend to have a lower risk profile, well, what about the parents and their families, right? And so as a coach or an AD who is trying to reestablish, some sort of workable framework, It's not just about assessing the athlete's risk tolerance, it's making sure that the parents or other guardians or family members are involved in sort of the collective risk tolerance decision. And so if organizations can host maybe community forums to kind of stake out the temperature of their community, including parents and athletes, but also provide them with the data to be able to make informed decisions, then I think that's probably an important component of moving forward.
Awesome. Let's go to the next one. How do we minimize injury in athletes since they're likely deconditioned from months of limited activity? And Dennis and I know are super excited to talk about this one. But I think we are all seeing this. And then actually we have a question that dovetails with that. If we're acknowledging that kids are deconditioned, are going to need extra time to get back, back into sort of to playing shape. Is that actually going to make sense with the shortened timelines that we're now maybe looking at? Like, how do we actually feasibly implement that? My first thoughts looking at this question are, well, first of all, I've seen a ton of kids who have gained weight. And also there's the real potential. I've also seen kids in the office recently that all of a sudden I'm like, wow, they're 6 inches taller than they were in February. And so some weight gain and then actually that growth puts kids at risk for injuries simply because they're not used to their bodies. And we see some of that, with or without COVID. And then two, I think we're seeing a lot of core weakness. The core muscles are they're the drivers of everything downstream. They're the biggest muscles in the body. And not only, having a weak core, it puts you at risk for things like back pain, but it puts you at risk for things like ACL injury. And so I think, to me, that's, as Dennis had mentioned earlier, and then I'll let him expound a little bit further. I think doing an individualized core strengthening program is key and hopefully actually has been ongoing. But if it hasn't been, I think that's something really to do. I mean, that's something that can be done almost every day, even for 15 minutes. And then the second thing is just a gradual ramp up, whether it's your 50, 30, 20, 10, or the 10% rule where, you increase a little bit each week. It is, I think that's really going to be essential for avoiding overuse injuries as kids get back into it. And one just thing I've recommended is going on a track, maybe early in the morning by yourself, walking a lap, running a lap, walking a lap, running a lap, or then you go to running and sprinting or however it might be, and you just try to increase that a little bit. But anything you can do to gradually increase endurance and build core strength, I think will be helpful for preventing actually the true sports related injuries that we see commonly even without COVID. Go ahead, Dennis. Oh, Julia. Yeah.
Quickly, because you just talked about it. You talked about going out to the track, and I really want to highlight the fact that because people are deconditioned, there's a much higher risk for heat illness because your body doesn't know how to process its own heat outside as well. And
that's something that kids are more at risk for anyway.
Well, yes, exactly. And even more so now, in my opinion. So as people are slowly ramping up their activity at home, whether it's, maintaining some base level and going out into the backyard and throwing the lacrosse ball around, and doing little activities at home that you can individually, coaches can really help with driving that, sending them pictures or videos of drills that they would have been doing if they were in a team practice. What can someone just do in their backyard? What can they do out in the park if they don't have a backyard? And then also making sure that the kids, if they are doing conditioning and running on a treadmill or a bike, that they are also practicing outside so that if their sport is outside, they're ready to make that jump.
Yeah, and I would just add to what you were saying, Cordelia. I think there's a real risk, and I'm already seeing it somewhat in the office, for both overuse injury and acute injuries. I mean, already we're seeing, that athlete coming in. I had a couple today. I haven't done sports for 2 or 3 months. I'm back doing it, and, they come in with classic, patellofemoral syndrome, whatever it might be, some overuse syndrome. But I think, unfortunately, too, we may see a bump in acute injuries like ACL tears, right? And you can compare it even to post-concussion. When you look at concussion data, it says for a few months after concussion, there's an increased risk for lower extremity injury, ACL tear, Granted, there's that whole neuromuscular piece, vestibular piece, bounce piece, but a lot of it still is deconditioning and weakness. And these are athletes that have been doing their sport their whole lives and have never had 2 or 3 months away from sport. So unfortunately, we might see, in addition, overuse and acute injuries, a sudden bump.
I don't know. So just, and then we'll move on, but like tips or that I have been talking to patients about, because the thing is, I think some patients and some families actually just don't know how, you know, what they can be doing, but there are a ton of apps right now that have, you know, pediatric and family friendly or adolescent friendly workouts, core workouts, for example, but also, I mean, I think this is a good time to introduce kids to the FIFA 11 Plus, which is a free website, which is an ACL prevention program. That's something that you can do on your own, like in anticipation of going back to sport and knowing that actually I think we are going to see higher risks or more vulnerability to sports injuries also.
Yeah, those are the perfect workouts to start athletes back on, exactly like you said, the FIFA 11. Any of those ACL prevention workouts are wonderful, right, for core and for conditioning. And Julia could speak to that. Julia, anything specific that you would recommend, specific type workouts?
Not particularly. I would say, like Cordelia was saying, there are things that you can do every day. There's like the 7-minute cycles. There's things that are body weight. You don't need any equipment whatsoever. So even if you're someone who just works out regularly on your own, or a kid that isn't part of an organized sports team, you can Google, and, you know, obviously make sure that it's a reputable source, but you can go to the National Strength and Conditioning Association website, National Federation for High School Athletic Associations, go to organizations' websites like that and try to see if there are any resources that you can use to just do on your own.
I agree.
And you don't need to buy anything. You don't need a whole lot of space. Like the 7-minute, I have it on my phone, not that I use it, but it's like it's a 7-minute workout, everything you do for 30 seconds. And it's like an all out, like hold a plank, do a bunch of body weight squats, do walking lunges. And it's just 30 seconds and you run through it for 7 minutes. You're like sweating by the end. And I do it in my 600 square foot apartment with no equipment. So it's doable.
All right, I see you advanced it. So let's. So are there? No, this is perfect.
Sorry.
Different considerations related to game changes and spectator rules for indoor versus outdoor sports. I mean, I think this is an opportunity basically to talk about what rule changes, how do we manage equipment. You know, what sort of general recommendations can we make about how we're going to create a new norm based on existing data? And that can be for, actually, Dr. Pellet-Matt, I know you have some ideas also for equipment, maybe, and Julia or Dennis or anybody.
Sure. So there are guidelines from the CDC regarding how to both clean and sterilize equipment. And I think, you know, training equipment that multiple kids are using is what we call high touch equipment, meaning there are multiple people utilizing it in a short period of time. We don't necessarily clean or disinfect playgrounds, but actual training equipment is a little bit different because the kids are coming into really protracted continuous contact. So that does need to be clean and disinfected according to the CDC guidelines. And then I think in terms of indoor versus outdoor, you know, again, it comes down to kind of the number of people involved and how close together they are. Overall, for indoor sports, I think we really want to try to keep spectators to a minimum if spectators are present at all. For little kids, you know, they probably really need to have a parent there. For older kids, we may have to limit the number of spectators who are present so that we don't have too many people in an enclosed space. But again, outdoors, people, as much as possible, need to maintain their distance, and particularly the adults, when feasible, it's best that they wear a mask.
I can speak to this a little bit. So for indoors or outdoors, like I said, like right off the bat, anything that can move outdoors, just move it outdoors, right? So is there a basketball court with 2 hoops? Maybe the basketball team just plays outside, even though that's not typically something that they would do. I went to that wrestling tournament down in Florida where everyone is outside. It's unusual, but if you're prepared for it and that allows you to play a little bit more safely, that's definitely something that you can do. There are some game changes for like rules for specific sports that can help decrease risk. So for instance, in soccer, maybe you do kick-ins instead of throw-ins. There's also been some discussions about removing face-offs from lacrosse, and really that could go to any sport, and just doing a coin toss, and then you start as if it was like a throw-in from the sidelines. So just those little things that you can change in the game's rules to spread people out a little bit more. Like soccer, maybe you remove heading so that people aren't like spitting in each other's faces when they're jockeying for the ball. And for the spectators, like Rebecca Pellet-Madden said, limiting that as much as possible. And they need to socially distance the way everyone else does. So if you're thinking about the rosters, the soccer team, you're usually standing right next to each other and both teams are on one side of the pitch. Maybe the teams can be on alternate sides, on opposite sides, so that they have the whole length of the field to spread out. And for baseball and softball, you have the dugout. So in order to distance, maybe you need to move half of the team into the stands. So then you can't really have spectators because there's no room for them anyway. I think those are my specific considerations.
I would say three things. The first is that I like that as a concussion specialist, you specifically mentioned headers in soccer. Two, for any of you who missed it, the wrestling match in Florida was pre-COVID. It was not like last week. And the third thing also just flew out of my head. Apparently only two things can stay in there at once. But let's, Dennis, I see you.
Well, you know what I was gonna, and a big question here too, and to get Dr. Pellet-Madden again to comment. It's one thing for a team to practice in a small group, that whole concept quarantine where they're just practicing for potentially even maybe a whole season just within their team. But when can you feel comfortable opening it up into the community? So playing community teams and then going cross community. And is that really just a question of how we started this with the rate of infection?
I think for that, we also need to remember that we have to follow the local guidance, as Brendan Parent was saying. The Department of Health for your locality probably has some expectations. So the sport organizations, the schools should be communicating their plan back to the local Department of Health to make sure that they're in line. And by opening up that conversation in the planning stages, when things inevitably get worse, I feel like we should just prepare for that so that if it doesn't happen, we've hedged our bets a little bit. But you open up that line of communication so that they can let you know if you need to start, phasing backward and maybe breaking people up into pods again if you have been doing full team practices. Or as Dr. Cardone likes to say, the corn teams. I call them pods personally.
Dr. Pellet-Madden, do you have anything to add to that?
I mean, I know what I would like to see in an ideal world. In an ideal world that unfortunately still has COVID, so it's not so ideal, I would really like to see the focus more on physical activity, scrimmages, kind of maintaining the social, the physical aspects of sport, and taking away some of the really competitive aspects that increase risk, like mixing with teams that are coming from a really extended geographic location.
Before we go on, there's one or two more questions that we had sort of prepared beforehand. But the other thing I was going to ask was, so for example, we were talking about injury prevention. I do think like FIFA 11 plus is a good one. But Julia, you mentioned the NFHS, the National Federation of High Schools. Are there other resources that you would send people to learn about rule changes, or if anybody has like resources that they think are particularly valuable to share?
Yes. Besides the National Federation for High Schools, because again, that's only public high school athletic associations, I would go to the sports national governing body. So USA Soccer or US Soccer, USA Hockey, and they should be communicating their own rules, their own changes, but also they may have recommendations for coaches or for parents as far as the training you can do at home or how you can progress. The national governing organizations, if they exist for the sport that you play, can be really, really helpful guides.
Dr. Pellet-Madden, do you have resources? I know you had mentioned early on, just basically really know your public health people, that like who's going to be your contact should you need to contact them about a problem, but ideally that's who you're going to contact as well to make sure that you're up to date with local epidemiology patterns. But are there other resources that you suggest?
You can also, bridge a relationship with the sports medicine program at your local hospital. They may have an infectious disease team that wants to partner with you, that can at least be your resource if you get into trouble. They may have a hospital epidemiology program that wants to partner with you. I think a lot of local departments of health it can be hard to get someone on the phone, but oftentimes if you just call repeatedly, you can get someone to speak to. If their data are not readily available. I like Julia's suggestion of going back to look at the national governing bodies. When I started to get emails about my daughter returning to swim class, I really appreciated that they made it clear that they had been in communication with USA Swimming and that they had kind of mapped out a plan with them, and it gave me a sense of, how we were going to proceed, and it made it clear to me that they had really put a lot of thought into this, and I appreciated that.
Awesome. Brendan or Dennis? Good. Okay. We are actually coming to the end of our hour. I think we can. I'm just going through some of the questions there. If you look at the chats, other people have also suggested resources, including NCYS, National Council of Youth Sports, major compilation document led by Wayne Moss, which was basically a compilation of all the best returning to practice documents from national governing bodies. NYS Guidance for Sports and Rec. So there are some others also in the comments. We touched on this. Let me see. There's a whole bunch of questions right now. We touched on this a little bit, but so how do you suggest this? And anybody can just raise your hand. Managing pre-existing issues like asthma or cardiac. I mean, I do think we talked on this a little bit, but anything to add? Dennis, why don't we start with you?
Yeah, I mean, I would just reiterate what I said. Those are the athletes that we need to pay special attention to right from the beginning on our pre-participation evaluation and clearance. Anyone who's had chronic medical conditions, certainly if they've had COVID, if they've been exposed to the virus, that's concerning. If they were exposed to the virus and had a particularly difficult course, or especially if they were hospitalized, of course, then these are the athletes we need to pay special attention to, and probably do need a specialist evaluation from a cardiac perspective, EKG, echocardiogram from a pulmonary perspective, seeing pulmonary specialists, get our infectious disease team involved as well. So, we certainly need to always err on the side of being more cautious and safe in this COVID environment, because we're still unclear about potential long-term risks. So anyone who's certainly displaying any symptoms still related to the COVID virus, obviously we're not going to clear them, and they need a good formal evaluation.
Okay, one more. I think maybe we'll get through maybe two more. So when starting a rec league for the community, should we start at full capacity or half? My thought on that is, I don't even know that is it full capacity or half, but it's, again, like, what is the sport? Is it indoor or outdoor? What are your local epidemiology patterns? What are the age of the participants? But I also think, I mean, to me, common sense just says, like, why don't you start out at half and see how it goes? I think all of this is sort of rather than just like come out and just say, well, let's do it. I think we can, we all gain experience, like learning from incremental steps with the goal of working back to the new norm. But does anybody else have a thought on that? Okay, I think there's one more question that would be, just because I think this is something that we all wonder about. And I think Dr. Pelletman will probably field this one. But so is the COVID-19 antibody test reliable for a return to play screener test?
Right. So we're really interested in antibody responses, particularly because, the phase 3 clinical trials for a number of COVID vaccines are starting this summer, and it'll be really important to see how people respond to them. I think, unfortunately, we do not know how to use antibody tests right now to determine a child's risk for getting infected or getting reinfected with COVID. And aside from a very few scenarios in the hospital, there's really no context in which we are recommending that antibody tests be used to determine whether children can safely go to school and participating in sports. And that's for a number of reasons. Every antibody test that's on the market is a bit different. Some of the test makers don't even tell you exactly which antibody is being targeted and how. So not only is there a question of whether the test itself is accurate, we have no idea if the antibody detected is actually protecting the child and for how long it's going to last. So I wish we had a way of knowing who is protected from COVID infection or reinfection right now. Unfortunately, the antibody tests do not give us that answer for children. I think we have to accept that, antibody or not, when our children go out into the world, there's a certain amount of risk related to that. And in some cases, that level of risk is acceptable because it's low and we have a tight family unit and the people in our home are healthy. For a lot of other families, the risk is unacceptable, and each family has to make that decision in the context of their community.
Awesome. Thank you. Oh.
Dr. Pellegman, and I have a follow-up question for you. It's very circumstance, I would think, but when do you, let's just say, if a youth league, maybe 12 to 15-year-olds, one athlete tests positive for COVID, acute infection.
Yeah.
So, when do you say, okay, guess what, the whole team, we have to stop playing, quarantine, or, under what circumstances is it okay to just do daily symptom checks?
I think the problem is that we don't know. Aside from kind of a few studies coming in from here and there in various parts of the world, we just really don't have a lot of information about what happens to a child, particularly an older child, when they are actively infected in the context of being with their peers. And I think I would go back to what Brendan said, was until we have more information, I think we have to revert to the most conservative option, which is I would at least halt play for the next 2 weeks. And I would, at the minimum, make sure that each family is aware that they are monitoring themselves for symptoms. If they've had really close contact with the child, so we talk about kind of close prolonged contact being contact in excess of 15 minutes where you're face to face within 6 feet of one another unmasked. So if the children have had really, really close contact, there may be a situation where your Department of Health recommends quarantining for 14 days, depending on the extent and the duration of the contact. But I think probably at the minimum, you're going to need to halt play for a good 2 weeks or so until you know what's going to happen.
Are you guys still able to hear me? Because I lost you.
We can see you and hear you.
I cannot see or hear you. I mean, I can hear you, but but I was going to, if it's okay with you, I do think just in the interest of time, we should wrap up. I think, what I have learned, I think from this discussion is that one, as we all know, like the landscape of what we know about COVID is constantly changing. And so then, I think what we all can do is to just try to stay abreast of the data as it comes in and try to then do our best to apply it to our own situations. I think one of the main takeaways is to know our local epidemiology patterns and to monitor those for change. because that's really going to be, I think, the best thing to help us make informed decisions. And then I do think this concept of risk tolerance and understanding that everybody's is a little bit different, but risk tolerance while still being responsibly or behaving responsibly in the public arena, just to protect our peers and our communities is also imperative. Does anybody have anything else that they want to add to that, or things to share?
I think I certainly, again, would say that we should certainly promote exercise and activity, and obviously it needs to be done in a safe fashion. But even if it's not as a team, it could be individually or as a small group. You know, we should be encouraging. It's just such an important part of life and the benefits, mental, physical, for our youth athletes, especially that we're talking about. So, you know, in a safe way, we should, even in this environment, be encouraging athletic sports in some fashion.
Right. I just wanted to say thank you to all the coaches and the teachers. You know, all the people who spend time with our children. If we didn't, you know, appreciate you before this, we really appreciate how much you add to our children's lives. And we want our children to be safe, but we also want you to be safe and healthy.
Awesome. All right, and then lastly, just for everybody, this will be available on our. This will be available as a recording on YouTube at the channel. It's youtube.com/NYULMC, or you can go to nyulangone.org/sportshealth as well. All right, thanks, team.
Thank you, everyone.
Awesome.
Take
Thanks.
care. Thank you.